Welcome to this video on the complications of the dobutamine stress test, a chemically induced form of cardiac stress testing. While the test is generally safe and well tolerated, it does carry some risks, especially since it artificially induces stress on the heart. In this video, we'll cover the key complications associated with the dobutamine stress test. First, let's discuss cardiac arrhythmias. During the test, serious arrhythmias like ventricular tachycardia or ventricular fibrillation can be induced, particularly in patients with underlying heart disease. Less severe arrhythmias, such as atrial fibrillation or supraventricular tachycardia, may also occur. Next, myocardial ischemia or infarction is a potential complication. The test is designed to induce stress on the heart to identify ischemia, but in some cases, this stress can lead to chest pain or even a heart attack, particularly in patients with significant coronary artery disease. Hypotension, or low blood pressure, is another risk. While dobutamine typically increases heart rate and blood pressure, it can sometimes cause a significant drop in blood pressure, leading to dizziness, fainting, or even shock if severe. Conversely, hypertension or high blood pressure can also occur, especially in patients with pre-existing hypertension. This can lead to hypertensive emergencies if not managed promptly. Patients may experience chest pain or angina during the test as the heart is subjected to stress. While this is often a sign of underlying coronary artery disease, it can be distressing and requires careful monitoring. Gastrointestinal symptoms, such as nausea and vomiting, are also possible, particularly at higher doses of dobutamine. Additionally, the increased cardiac workload can lead to shortness of breath or dyspnea, especially in patients with underlying lung disease or heart failure. This symptom requires close monitoring to prevent progression to more severe respiratory distress. Palpitations, or an awareness of the heartbeat, can be another side effect of the increased heart rate induced by dobutamine. While often benign, it can be uncomfortable and anxiety-provoking for the patient. In rare cases, allergic reactions to dobutamine may occur, ranging from mild symptoms like rash or itching to severe reactions, such as anaphylaxis. Injection site reactions, including pain, swelling, or redness, are also possible due to the intravenous administration of the drug. Finally, though extremely rare, the test can trigger cerebrovascular events such as stroke or transient ischemic attack, TIA, particularly in patients with a history of cerebrovascular disease or other risk factors. In summary, while the dobutamine stress test is a valuable diagnostic tool, it does carry some risks, especially in patients with significant underlying heart disease. Potential complications include arrhythmias, ischemia, hypertension, chest pain, and other cardiovascular or systemic reactions. This is why the test should always be performed in a controlled environment with appropriate monitoring and emergency interventions readily available. Thank you for watching. If you have concerns about the risks of the dobutamine stress test or questions about whether this test is right for you, please consult your healthcare provider.